Hello, everyone. Gareth Presh, founder, CEO of the World Health Innovation Summit. And I have been asked if I could put together a short presentation for those of you out there who are very keen to join our movement, our global movement. If you're interested in healthcare, please spend the next 5 to 10 minutes with me as I explain the work that we're doing around the World Health Innovation Summit, how you can join, how you can get involved, how you can engage your community. Health touches us all. I'm sure you're well aware of the problems. We all struggle at times to get GP appointments, but not just here in the UK, but all over the world. We face enormous challenges in healthcare. And health touches every single sector. There's not a person I don't know that will have family members, who suffer from, an illness or a diagnosis. And it's really important us as a community pull together and start to bring solutions to the fore. And this is what the World Health Innovation Summit does. It's a platform, it creates opportunities, it brings solutions from a local level to a global level. We think locally, act global, as they say. Sit back and just enjoy the next, shall we say, 5 to 10 minutes, and I'm going to explain the work that we're doing and how you can get involved. So first off, World Health Innovation Summit. We're empowering communities to manage their own health and well-being. It's very simple. How do we do that? We have to give people the tools to manage their own health and well-being. And I always get asked, like, what is WIS? And it's a platform basically that brings patients, clinicians, managers, voluntary sector, education, business community, academia, all together so we can co-create solutions. And we've been doing this since about 2025. The idea is that, you reduce costs on existing services and you create a business model and a commercial model that is a win-win for everyone. It really is about creating value and creating new opportunities, creating new jobs, creating, we know 80% of the determinants of health are outside into the community, but we invest, the vast majority of our investment goes into, the pathogenic approach, into our hospitals, and we know our hospitals are overloaded at the moment. So we reduce pressure, costs on the health systems just by empowering people to manage their own health and well-being. Now, why do we exist? Well, I think as I explained, we've got huge pressure on, for example, here in the UK, NHS, health systems around the world are just strained, particularly after COVID. They've been exacerbated and we don't have the staff. The numbers varies between, say, 10 and 18 million short by 2030. And you can see that all over the world. Whatever location you're in at the moment, you'll realize that we really struggle to recruit and retain staff. So we need to look at new models. We need to empower people, and we want to be able to take the pressure off the health service. The clinical workforce that we have there, at crisis levels, they're getting burned out. So how can we support as a community? How do we get this together? Our mission, vision, is around prevention, early intervention. We want to empower communities, thriving communities, as they say. We want to strengthen healthcare through prevention, early intervention, and innovation. It's all about like our collective actions. We do this, we align with the UN Sustainable Development Goals. You can see a great example there of some of the activities that we've been involved in, some of the events. We start off with an event. That's what we are. We're a platform. And then we build out sort of an ecosystem, a model, which is beneficial for all. We're a community interest company here, registered in the UK. We also have a donor advisory fund in the US called World Health Service, with Legacy Global, working with our partners, Moncom. What we do is you generate investment, you reinvest it back into the programs. It's about bridging sectors, as I said, bringing people together from industry, investors, governments, communities, and creating lasting, sustainable impact. And this model is replicable, so you can do it here in the UK, but you can bring it to Delhi, which, we're speaking to Indian colleagues. You can take it to Africa, you can take it to Latin America, North America. This model and framework works all over the world. we've been doing this since 2015, since I left the NHS, and we've been, prototyping. We initially prototyping, then we got the opportunity to kind of present this work at the World Economic Forum with the UN former Secretary General, and then it's all evidence based. We know for every pound invested, we generate about 36 in social return in investment. But with our programs, we know we can deliver new and meaningful jobs. So investors can invest in our programs, and we can implement these locally. We can reduce costs on the health systems, enormous costs on the health systems. So this is a really smart way to actually, drive economic growth as well. We know in the UK, for example, we've got about over 2.5 million people with ill health. It's costing the UK exchequer about 7% GDP. This becomes a fiscal challenge for the Chancellor. So this is an enormous opportunity to transition, a paradigm shift, invest in these new programs, to create new and meaningful jobs while improving people's health and well-being and taking pressure off the health system. It really is a fantastic opportunity. How do we unlock global investment? I've been engaging with investors now for the last couple of years, building networks, building sort of that collaboration, that approach, that partnership with investors so that we can bring the capital to support this huge opportunity. And I mean, it really is a huge opportunity. The ILO predicted we could create about 300 million jobs. This is massive, especially with the displacement of AI and jobs. But this is a massive opportunity. You can create social impact bonds, measurable health outcomes. We can reduce costs for governments, and we can bridge that. We can bring capital. We can speak to investors. We can speak to governments. So if you're out there, we can engage with new programs. Our WIS Kids, WIS at Work, WIS Seniors, our social prescribing work with the Global Social Prescribing Alliance. So it's a massive opportunity. You can create new ventures, innovators, global investors, bring financial institutions together all through this platform. Our ecosystem, we have a massive global network. We're working all over the world in almost, our recent summit there on social prescribing, for example, we had countries from 50 countries engaged. We bring, all that collaboration, that shared experience, that understanding at a local level and bridge, to governments to enable that change. It's really powerful. We've been involved in policy transition. I've been, an advisor to the ministers for years in my former job in Ireland. We set up the Global Social Prescribing Alliance in 2020 with our partners, launched with the UK Secretary of State in 2021. Myself and James, he was the former CEO of the National Academy of Social Prescribing. We presented this work at the G20 Global Solutions in 2021, where we introduced the playbook for social prescribing. I've been to the European Commission, EU, worked as a member of Pope Francis' Vatican COVID-19 Commission. So we really are looking at how we move the dial in terms of policy, enabling policymakers to make informed decisions based on, evidence-based outcomes, because we know this work. People skills, community, how do we develop the future skills? I've been in Indonesia. I've been working in terms of spreading the knowledge, the understanding. We need a whole pipeline. You're going to need a lot of new workforce. We want to empower the community to take charge of their own health and well-being. You need education, you need connection. We've been bridging between health and environment at the COPs, and we know it works. As I said, even from a professional perspective, 77% or 67% in who have attended WIS improved their professional networks. 63% said they had better access to new ideas, and 48% reported less isolation, which is a key part of burnout within our system. So we really want to empower the entire ecosystem, and we have to take this holistic approach. We cannot look at health and economics separately. They are all one. Good health equals good economy. That's as simple as that. So also how to get involved, getting to the point now, you can create your own chapter. We are doing this. We have very successful chapters now, particularly in Ireland and Italy, establishing them across the US, in Chicago, San Francisco, for example. We're building these out. I had 2 meetings this week with London and Nottingham here in the UK. And we have chapters emerging in Portugal, in Germany, and other areas. We launched in Italy just over 18 months ago. We're looking at social impact bonds, for example. And really, this is a call to action. Like, so if you're watching this and you want to get involved, go onto our website. We have a whole playbook and you can download it. You can see how you can get involved, establish your sort of governance around how you as a volunteer can create your own WIS chapter in your location. You can create your own activities. You can become involved in the networks. We have special interest groups that meet every month, for example. You can collaborate with colleagues all over the world. You can join the movement. You can plan activities. We'll support you. I'll support you. We'll get involved. We'll give you the playbooks. We'll enable you to empower yourself at a local level. And then we work collectively to, bring projects to fruition. We really want to co-design, co-implement solutions globally. What works in Delhi, this is a local level opportunity as well. We know each level or each community is unique, and we want to be able to empower those communities and give you the platform to be able to do that. We have lots of solutions. Those solutions can be springboarded all over the world. That's what's super exciting about this, like building healthier futures together, working as a collective. It's really super important, generating value and sharing it. So if you are interested, go onto our website. You can, if you've got a city, a region, a country, organization, university, local leaders drive to change. It's empowering the local leaders. Leaders create more leaders. And we'll support you with branding, the structure, the guidance, speaker access to our events and activities. We've been setting up, for example, podcasts from London. We've got one on the pipeline for Chicago. We'll give you program models. We'll equip you with the tools and networks to succeed. We really want you to be a winner, and your community. We all win from this. It's a win-win opportunity. Finally, like if you're pulling together a chapter and you're saying, well, how do I start? You need a chair, you need a co-chair. You'll bring together a comms lead, an operation lead, outreach, recruitment. This is all in our playbook. You can download it for free at our website. Please get in touch. We've got a lot of chapters already established. A lot of the chapter leads, the chairs, co-chairs, the people involved, they're more than happy to spend, 15, 30 minutes, with a call. So hopefully that gives you a kind of an insight into what we've been doing here. I've gone slightly over. I said I would try and keep 10 minutes for this overview, but we've just gone to 13 at the moment. So any questions, please reach out. You can get me across LinkedIn. We have our social medias that you can follow us on Facebook, and reach out, get involved, connect with our chapters all over the world as they grow. And finally, just to say thank you, and I'm grateful for this opportunity to be able to work with everyone. And let's get started and look at health as a future economic driver, and bring these solutions to fruition, bring the deals, bring the opportunities, bring the investable models, bring these new opportunities to investors. And then let's create, opportunities, not just for ourselves, but for our children's children, and I'm super excited to get going. So any questions, just ping me, and hopefully this video has been helpful, and I'll share it across social media, and wishing you and ourselves every success in the future. So thanks very much.